Namaskara. I am Dr. Roopa Sibi Shekar, Consultant Obstetrician and Gynaecologist at Motherhood Hospital, Sarjapur Road, Bangalore. Today I am going to talk about a topic called ectopic pregnancy. Ectopic pregnancy is a condition wherein the fertilized egg gets implanted outside the uterus. So there are various sites of implantation in these ectopic sites. This is the picture of the uterus with the fallopian tube, the ovaries and cervix. So the ectopic sites, the most commonest site of implantation is the fallopian tube. Next comes the ovaries, the lower part of uterus, that is the cervix. Sometimes if the patient has undergone a previous cesarean section, then it can get implanted in the cesarean section scar, and also sometimes it gets implanted in the abdominal cavity. So what are the causes of this ectopic pregnancy? Usually the cause is the infection or inflammation in the tubes or in the pelvic cavity. So what are the reasons for this? It can come due to many risk factors, like if they have had a previous history of cesarean section, then they have a high risk of implantation in the cesarean section scar. And if they are wearing a IUCD, generally the pregnancy with an IUCD is very rare, but if it happens, it is more likely to be in the ectopic sites. If they are a smoker, then the motility of the tubes will be reduced, and therefore there is a high risk of implantation in the tubes. These are some of the risk factors. And also if they are having multiple sexual partners, they are exposed to sexually transmitted diseases like chlamydia and gonorrhea, and this also can cause a high risk for getting an ectopic pregnancy. So how to detect this problem? It can be easily diagnosed by the symptoms and also by some tests. So the symptoms of ectopic pregnancy are, in early stages the patient does not have any major symptoms. It will be like a general pregnancy itself, like a missed period or a breast tenderness, nausea, vomiting, etc. But as the pregnancy advances, it can cause sudden severe onset of abdominal pain in the lower abdomen, especially situated to one side of the abdomen. And also it can cause giddiness and even hypotension. And some patients present with vaginal bleeding and shoulder pain as well. And when we do an ultrasound scan, we can diagnose this condition. So how to treat this problem? So if it is detected very early in pregnancy, then it can be easily treated with an injection of methotrexate. But unfortunately, if it is detected very late, it can cause rupture of the tube and internal hemorrhage, and therefore it can be life-threatening to the patient. In that case, we might have to do an emergency surgery, either a laparoscopy or a laparotomy, and the excision of the tube or salpingectomy in order to save the life of the patient. So many people might ask how to prevent this problem in future. Unfortunately, there are no preventive measures. But like I said, all the risk factors what I have mentioned earlier, like sexual promiscuity, smoking, and all this can be reduced, so that we can reduce the risk of getting recurrent ectopic pregnancy. So I hope you have understood something about ectopic pregnancy today. Thank you for hearing me, and have a great day. Namaste.
Motherhood Hospitals. We care like no other.